been an interesting year, hasn't it? Who would have thought at the start of 2020 that our world was about to change in so many different ways? In the space of just a few months, we had to learn so many new things, getting to grips with face masks and PPE and infection control processes, telephone and video consulting, social distancing, whether we could even have any of you in the building, and all of that while learning about a brand new disease and then a vaccine that nobody had had before. And like you, we moved through various phases of anxiety and stress at the beginning, boredom of lockdowns, the pain of not getting to see our family and friends and cancelled holidays and comfort eating. But as the months passed, the challenges have shifted from running out of toilet paper and bread flour or learning how to use Zoom. Some of you have worried about overwhelming us in the health service and have held off from coming to see us much longer than you normally would, and maybe much longer than you should. Some of you have had major challenges to your mental health during this last 18 months or so. And our children, our young people have lost so much and have been affected mentally with more anxiety and other issues coming to the surface. Perhaps you had an operation that's been cancelled and you've got no word of when that's going to happen. And the symptom that you were just about managing is less manageable now. Or maybe you haven't got to see your hospital specialist for over a year and you're feeling a wee bit adrift and not sure what's happening. You might have had questions about the vaccine and not knowing where to go for solid information on that one. You might well have been frustrated about some of the changes that we've had to put in place in the health centre to keep everybody safe, and found that difficult to adjust to, as have we. Perhaps you've needed the hospital in terms of A&E or minor injuries and have been shocked by how busy it is or how long you've had to wait. You might have needed carers or social work intervention for a family member and had to wait much longer than usual for that. Or you may well have lost somebody to COVID or during the pandemic when that whole process of grief and bereavement was so much more challenging. Even though there are some hopeful signs that things are beginning to improve, although numbers are currently spiking again, and we are moving slowly towards the light at the end of the tunnel, it does feel as though there's still quite a lot of tunnel to navigate, doesn't it? Believe us, each member of our team here has experienced some of those challenges in our own lives, with family we worry about and some exhaustion at just the sheer slog of it all. All that to say, we know this is hard. The challenges facing general practice have never been greater, and we're tired of it as well. And yet, we are so thankful for the kindness and compassion that many of you have shown us in the community, with the local helplines and meal provisions, and countless offers of help to those more vulnerable and shielding. We're thankful for the support you've given us and our practice team. We know that we don't always get it right first time, and that change has been really difficult for all of us, but you have almost invariably been patient and thoughtful and borne with us. Our community is a wonderful one. It's one that we're proud to serve, and we know that with your support we can navigate whatever lies ahead and continue to provide you the care that you're used to now and on into the future. Thanks, and take care.